Hi, Katie. Welcome to your cranial nerve exam.
Hi, how are you?
I'm great. How are you?
Great.
Good. No concerns or anything before we get started?
No real concerns. I got sometimes headaches.
Okay.
And just like a little bit of numbness on the right side of my face.
Headaches. Numbness on the right side. Is it on your face, on your scalp?
I'd say the top of my head, so a little bit of the scalp area, and just my face too.
Okay, absolutely.
Sometimes it's hard to tell.
Yeah. Do you know if you're clenching at night or anything?
I do.
You do?
I do
Okay.
a lot, yeah.
Clenching at night. And what is your sleep schedule like?
I go to bed pretty late. I wake up early in the morning, so I probably get like 5 or 6 hours of sleep a night. It's not ideal, I know.
Yeah. And is this just kind of based on like your decision, or are you unable to sleep at night? Does it work?
I have some insomnia. Yeah.
Insomnia. Okay. And are you on any medication for that right now? Is it helping?
Yeah, I take trazodone, 50
Okay.
milligrams a night, and it does help sometimes, but I'm like leery of upping my dosage and just becoming not dependent on it, but just it's losing its effectiveness over time, and
Absolutely.
just having to keep upping the dosage, so I just don't know.
Okay.
Yeah.
Absolutely. I definitely think that we should have an appointment based on the medication itself separately to this to help with the sleep regulation. Maybe we can look at some natural remedies or something, but we'll definitely want to keep a look at that for future appointments and schedule that separate appointment to evaluate in more detail.
Yeah.
Because I think the lack of sleep is what's causing the hardship and the clenching in the jaw.
Yeah.
And I think that's what could be causing the numbness. There's probably a pinched nerve. You might be getting some TMJ and then causing that irritation in the scalp. So we'll take a look and just make sure that everything in this assessment in regards to hearing and taste, smell is at least receptive and good. And then we'll go ahead and do sensory checks too to see how everything is, and that'll help with our next appointment.
Okay, thank you.
Awesome. Yeah, no, absolutely. No allergies or anything?
Not to any medication that I'm aware of.
Okay.
No.
Okay, Katie. Let's go ahead and start with vitals.
Okay.
And we'll go from there.
Okay.
We're just going to start with your temperature. Okay, 31.9 degrees Celsius. Okay, perfect. I'm going to check your oxygen. Okay. Okay. And while that's going, check your blood pressure. Blood pressure to 120/60. Okay, so no concerns there. And the oxygen looks to be 96-97%. Perfect. Okay. And check your heart, make sure there's no irregularities.
Okay.
Okay. S1, S2, no S3. Sounds normal. Perfect. Go and check the lungs. And 2 times, I'm just going to have you breathe in deeply. Perfect. And 1 more time. Okay, lungs sound great. I'm going to get some gloves on and do some face palpations. Overall, I just want to evaluate the skin. And the muscles. Okay, sinuses feel okay. Thyroid feels okay. Good. Go ahead and open and close a few times. Okay. I do feel some popping on your right side here on your jaw. Did that hurt when you do that?
A little bit. It just like pops sometimes.
Okay, absolutely. I may want to incorporate some exercises that we do, especially in the mornings, just to kind of help alleviate the tension in the jaw and those muscle areas, which are inflaming and causing that joint to become stuck and create those clicking noises when they're rotating within each other's sockets. So let me make a note. Feel a lot of inflammation on your right masseter muscle over here. Okay. Begin with a hearing check.
Okay.
Just to make sure that everything looks good and that you're hearing equally on both sides.
Okay.
Now you turn your head to your right. Just gonna make sure ears look okay. Perfect. Normal color, light pink. Looks healthy. No tears, no scratches, no inflammation. Beautiful. And we'll check the other side. Go ahead and turn your head to the left. Okay. Same thing in this ear here. Looks healthy. No concerns. Okay. We will now begin with the hearing test and my vibration tool. I'm going to hit my tool and it'll make a vibrating sound. Please let me know if you hear it on your left or right side.
Okay. Left. Right. Left. Right.
Which side do you hear this on?
The right. The left.
Now I'm going to say some words on either side of the ear. Just repeat those words.
Okay. Fall. Fall.
Crystal.
Crystal. Leaves. Leaves.
Snow.
Snow.
Air.
Air.
Perfect. Okay, those were correct. Everything seems to be okay. With your ears, you're hearing everything on both sides equally. No concerns. So I'm going to begin a sensory test to check the numbness, seeing how everything is feeling and where it's actually located to document.
Okay.
And go from there.
Thank you.
Thank you. I have a dull and sharp tool. Go ahead and just let me know which one you feel. I'm going to start on the right side of your face.
Okay. Dull. Sharp. I didn't feel it. Sharp. Sharp. Dull.
I'm going to go ahead and go to the left side of your face.
Okay. Sharp. Dull. Dull. Sharp. Dull.
I'm going to do one more test. Warm and cold.
Okay.
This is cold. This is warm.
Warm. Warm. Cold. Warm. Warm. Cold. Warm. Cold. Cold. Warm. Cold. Warm.
Going to blow some air onto your face. It's going to be either 1 or 2 times. Go ahead and just let me know how many times you can feel it.
Okay. Once. Twice. Once. Once. Twice. Once. Twice. Twice. Once. Twice. Once.
Okay. We definitely had some confusion on this side where you were experiencing the numbness. Definitely think it's associated with this muscle inflammation in your jaw joint from clenching. I think we have some pinched nerves. Like I said, we're going to start with just some exercises that you can do at night, but definitely in the morning. And those should hopefully alleviate. If that doesn't work, then we can go into some massage techniques and scans, but we'll start there. As far as your assessment, though, everything else seems to be going well.
Okay.
Go into your smelling test to make sure that at least you're smelling correctly. It's our first smell.
Is that rosemary?
This is frankincense. It's pretty close.
Okay.
And coming in with the second smell.
Lavender.
Eucalyptus.
Okay.
That's okay. Your third smell.
Orange.
It's grapefruit.
It's closer.
It is. It is in the citruses. Okay, and we have 2 more.
Cinnamon.
Yes, cinnamon. Okay. And our last one.
It's very sweet, so maybe cinnamon.
It's vanilla.
Vanilla.
Yeah.
Okay.
It is very sweet. Okay. Have you had any recent congestion?
Yeah, I have allergies pretty much all year round. So I do nasal spray, and sometimes it's hard for me to smell.
Okay, absolutely. What kind of allergy medicine are you taking?
It's just a Nasacort and nasal spray.
Okay.
I'm not taking any other allergy medication, but open to any suggestions if you have any recommendations.
Yeah, absolutely. And you said this happens to you year round.
Year round, yeah. It's just it's hard for me to smell, and I always feel a little stuffy.
Okay. Have you ever had an allergy test done?
Yeah.
Okay.
I think it was wrong though, because it said I was allergic to everything, but it was all for foods.
Okay.
Not for pollen or anything.
Yeah. I was going to say, because it seems like it might be something in the atmosphere that might be causing you some issues that we maybe need to look at, not necessarily food-wise. That could be causing that. That way we can get some clarity and you can breathe normally. Because I'm sure it affects your taste a little bit too.
Yeah, absolutely.
Speaking of that, we're actually going to go into a taste test. So I'm going to grab some samples, and it's little strips, so I just put it on your tongue and you just let me know what it tastes like, okay?
Thank you.
Thank you. Okay, so we have our first test. Open. And what does that taste like?
Just like paper.
Like paper?
Yeah.
Okay, that was rosemary. Which I know in the smelling test we had some irritation with that too, and it didn't come out right, so I'll keep that in mind. Okay. We have another one here.
Very bitter.
Okay. It is ginger, so that one was a little better. And this one.
Sweet.
Okay. That is right, that is strawberry. So,
Kind of like paper again, honestly.
okay, that was pepper. Okay. I'm going to do some tapping along the sinus areas just to maybe help open things up a little bit.
Okay.
And then we are going to put in a test for environmental allergies to make sure that maybe nothing is in your home. Have you ever tested your home for like mold or anything like that? Any concerns?
No, and I live in a pretty old building.
Do you?
So.
Yes, yes. Okay, that could be the cause of it. I'm wondering if that's doing that. Do you have an air purifier?
No, I don't.
No. Okay. that might be useful. Okay, let's just try to open things up and see how that goes. First, I'm going to do some pulling on your ears.
Okay.
So just lifting out and up.
That feels really good.
Good. I'm going to go on this side. Out and up. So it's going to help release in that area. Okay. I'm going to go under here. I'm going to pull it up and out. Some light tapping. So within the next couple days, that fluid should start becoming released and coming out, all that mucus and everything built up. And that should help a little bit with everything. And then we'll just go deeper evaluation on the allergy test. And if everything seems to be okay with that, then I would do some home tests.
Okay.
And get an air purifier for sure. So
Okay.
we're going to do your eye check next.
Okay.
And then after that, I think we're pretty much done with your cervical exam test today.
Okay.
Okay. We're going to begin with your eye exam. First, I'm just going to take a look with my light. So go ahead and look straight ahead at that dot up there. Have nice focus. We're going to make sure everything's dilating correctly. Okay, yes. We go on this side. Perfect. Dilation is good. Just making sure now that the pupil is healthy. Skin around your eye is healthy. No yellowness, no jaundice, no cataracts. Check the other side. Yes, okay, same here. Everything looks good in your evaluation. Let's go further and see how our vision is. I'm going to have you go ahead and read this line.
DHJBS.
Yes. Now go ahead and close one eye and read this line.
EPTCO.
Perfect. And then close the other eye and open the other one. There you go. And read the same line.
EPTCO.
Perfect. And open both eyes. What is this color?
Green.
This color.
Red.
What is this number?
9.
And this number.
6.
Perfect. Which one is bigger?
9.
Awesome. What is this number?
7.
And this number.
5.
Which one is smaller?
5 is smaller.
Perfect. Okay. 20/20 vision, no concerns. So glad. Awesome. Now just one more test. I'm going to bring you're going to look straight ahead at the dot on the ceiling. I'm going to bring my hands in and you're going to let me know when you see it in your peripheral vision, okay?
Okay.
Okay.
No. 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 No.
And one more time.
No.
Beautiful. Okay. You have a nice range of vision here. So to finish everything out, we're just going to review everything. So vitals were perfect. Medical history. We're just going to evaluate allergies for environmental. And we're also going to incorporate exercises for the jaw. So when you leave today, they'll have a treatment plan up front to schedule that next appointment. It'll have all the instructions.
Okay.
And at your next appointment, we'll evaluate in more detail on those allergies and also see how the exercises have been going.
Okay.
And then from there, I think that should help with the headaches and the sore jaw and numbness. So, and if not, we'll do further tests.
All right. Thank you very much.
Thanks, Katie.
All
Have
right.
a great one.
You too.